Hello, people. Um, I was going to do another post before the last one, but I've been really ill. I was hit by huge, intense pain and I had to go to ED. So I had to call an ambulance. So I just wanted to talk about my Asherman's syndrome and endometriosis chronic pain journey. 13 years I've been dealing with pain, and not just pain. So I'll go back to the start. I'm being really open and honest here because I have written on Facebook the catalyst for me being in this situation, but I'll go over it anyway. So in 2009, I was married and I was pregnant with my first pregnancy, my one and only pregnancy at that time. At my 3-month scan, there was no heartbeat. And I was told that I needed an ERPC, which is to remove the remains. When I say told, there is an option to take tablets to see if that will remove it. But I was kind of forced into having an ERPC. And at that time, I wasn't really aware. I trusted doctors. I trusted the nurse. Now I look back, I can kind of see now those entities for who they are. So I had the ERPC. Following that, I stopped having periods, which was not usual for me. It took 8 months to be referred back to my doctor, to be referred back to the gynecologist, sorry. The gynecologist said that I would need a couple of tests. So following those tests, I was told, okay, you just need surgery. It maybe take 1 or 2 and, you'll be back to normal. Had the first surgery. During that surgery, there was a lot of things that shouldn't have been done. The way it was handled, they went in with laser into the uterus. I then had another surgery. And at that time, my husband wasn't there. And I was already pretty devastated with the miscarriage, which is what they call it. So coming around from surgery, I asked them, so, what's the outcome? And bearing in mind, I just had anaesthetic, I just had pain relief. I was told there's nothing more we can do. You're looking at surrogacy or adoption to have your own child. And it was as blatant as that. So I called my husband. He was mad because he said, why did you tell her this on our own? We went back to the consultant and I can't remember the exact discussion. The one thing I do remember is he sat back in his chair, he crossed his arms and legs, and he said, you'll get nowhere in court with the NHS. Now, we never mentioned anything about court or anything legally at that time. Following that, I had a breakdown. It was the arrogance. It was that we've done nothing wrong. It's you. Now, that I was supposedly at my 3-month scan, but it hadn't progressed past 7 weeks. So the size of that was nothing. How can that surgeon scar the whole of the womb and cause me to become infertile from that procedure? So following that, I lost my job. I was working as a PA at that time. We lost our flat and it split up our relationship. I've been on pain meds for 13 years. Following that, at that one time, I was on oxynorm, morphine. I was on tramadol. And I was also on naproxen for the inflammation. Let's move to 2014. I became really ill. I lost loads of weight. I couldn't eat. I felt sick. I was living on my own at this time, and I stayed in that flat and not been able to move, waiting to be referred to someone. I don't know how many months that was. And I was saying to them, something is poisoning me. I'm 6 stone. I can't eat. Nothing tastes right. I've got pain. I've got headaches. The pain goes all the way out my body into my head. So I finally got referred to a gynecologist who I did like. And following that surgery, he had said to me that the blood was going back up inside the body and getting trapped in the pelvic muscles. As soon as I had that surgery, I had a huge release. But the pain continued. And the dependency, I'm not saying addiction because it wasn't addiction, the dependency on pain meds to control all of my symptoms was unbelievable. I went through the complaints procedures. I went to the chief exec of Imperial College Healthcare. I got a really blunt letter back to say nothing was done that was wrong. They didn't do anything wrong. He didn't do anything wrong. So my life cut off in the UK, and I was fighting the system. I was on benefits. I was fighting that, fighting for my health, trying to keep my employment support allowance. They cut that off. So they cut everything off for me because I was trying to stick up for myself. So in 2019, I came to Aotearoa, New Zealand, and I continued this journey. So currently, I came off of the morphine. I came off of it myself. And that is not easy for those of you know that are on pain meds or any sort of dependency or even addiction. It's impossible to do it yourself, but I was determined. So I no longer take Oxynorm, but I have been taking this pregabalin. This is given for women with chronic pain. So I have been on that. I've been on fluoxetine for depression. I've been on naproxen as well for the inflammation. I got to a point where I said, I've had enough of this. I wasn't born with this. This was done to me. Why should I now be going through this dependency on pain meds and other things when really I want to get to the root cause of what happened and get justice for what happened to me? Following that journey, I've uncovered a lot. So I decided that I wanted to go and see a medical herbalist. So fortunately, because I became a resident here, I was able to claim emergency benefit because I wasn't entitled to anything. That's another story of why I got to that point. So I went to a medical herbalist and I've been on this herbal remedy. Now, there's many different herbs in here, but one of them I do want to mention is skullcap. And skullcap is a natural remedy from a plant for depression. So I no longer take fluoxetine. I'm on this. I've also been given this, which is to cleanse and support the liver. Because for those of you that already know, all of these pain meds affect the liver and affect the kidneys, in fact. I'm also on a B complex. You can look all of these things up. This has helped a lot. And I've also had some treatment for chronic pain from a healer at Totonu. And he's helped me shift a lot of the trauma. So I went back to my GP and I was saying to her, look, I don't feel well. I'm losing weight. I've now lost 10 kilos from 64 to about 53. I want to get to the bottom of this, and I'm determined to get to the bottom of this. I'm not living like this anymore. So after battling through the system and trying to be heard, and let me just say my GP is very good and she works within the law and she works to do everything she can for me that she's able to do. But as you know, this is the system and it's set up a certain way. So I asked for an x-ray on my abdomen. I've had all sorts. I've had an endoscopy in the UK. I've had a colonoscopy in the UK. Nothing at that time was found. So after an x-ray and a CT scan, I've been diagnosed with something called SMA syndrome. And I'll read it to you. And let me just say, first of all, I'm 44 now. And the effects of endometriosis, Asherman syndrome, anything internal like that, can cause serious problems later on. I met a young girl in her 20s and she was in hospital and she lost the use of her legs. And she had endometriosis and she wasn't being heard. So SMA is this. I'm telling you this so that you can be aware to advocate and fight for your own health, because if you don't do it, no one else is going to do it for you. Superior mesenteric artery syndrome is a rare condition that involves compression of the third portion of the duodenum, which is the upper part of the small intestines just past the stomach. This condition occurs when the third part of the duodenum is compressed between two arteries, the main artery of the body called the abdominal aorta, and one of its branches called the SMA. The SMA provides blood supply to the small intestines and the first part of the colon. Compression of the SMA against the AA can prevent duodenal contents from draining into the upper small intestine, hence the inability to get proper nutrition, leading to weight loss and malnutrition. Pain from the compression can be debilitating, causing food fear and aggravating the condition. Nausea and vomiting are manifestations of the compression of the duodenum. When weight loss is persistent, the mesenteric fat pack decreases and causes a decrease in the angle between the SMA and AA, hence in aggravating the compression and obstruction. Prompt diagnosis and early treatment are essential to avoid significant complications or death. Now, I have been fighting to get validation and confirmation that everything I've been feeling and sensing is not in my head. And I've never thought it was in my head, but I've been made to feel it's in my head. So my GP referred me, from my understanding, to a gastroenterologist. I was put on a top priority referral, which means I have to be seen within a month. My appointment was on the 8th of December. Now, because I can't eat very much, because anything I eat makes me feel sick, thankfully, I don't really have to take any pain meds because I'm on omeprazole, which stops the reflux. And I'm then on Buscopan to help with the stomach cramping. So if I take both of these before a meal, and sometimes after, it will stop that condition from aggravating further. So I'm putting this out there because I want women to understand that this is a chronic epidemic. There are so many women that are having hysterectomies that don't need to have hysterectomies. Scarring internally. I heard a really terrible story. I thought that female genital manipulation was illegal in New Zealand. But I heard a story that a young girl, had that done to her. There's a group of women and we are trying to get justice because these psychopaths are working within the health system. They're allowed to work within the health system. And it needs to stop. One thing that we've also uncovered is, which I found out from Citizens Advice Bureau, is that there was something decades ago called the unfortunate experiment. And it was about women that had cancerous cells in their cervix. And instead of treating those women, they waited to see what would happen. They waited to see how it would evolve, tried them on different drugs. To me and to these women, this is a war on women's health. It's criminal. And it needs to be stopped. So I am coming out of my shell and speaking out about this because this is 13 years of my life. And the man that did this to me started in 2009 in Imperial College Healthcare. He now has his own, how shall I say, it is a business in Saudi Arabia, training up people, and he's wealthy. And me, I've been poor for 13 years because of him. And I'm determined to get my justice, and I'm determined to get this story out there. And I would encourage every other woman to do the same, because unless we speak out against this, no matter what happens, it's not going to change. So watch this space, guys, because I'm trying to set something up. I don't want to talk about it too much at the moment. But I just want to encourage all women out there to talk to someone. Please like the post. Please share the post. This is coming from a raw energy inside me. So I don't care what I look like. I'm not about being an influencer. I just want to get this truth out there. So thank you for listening for 16 minutes, and have a great day.